What interests do you have? Like, what interests did you have when you were like our
I would
age?
really like if you did that.
I can do anything.
Animals.
How did you get this career opportunity and decide to do this job or career?
I decided I actually had a different degree, and I went back to school to become a chiropractor when I was in my mid-20s. And I just decided I wanted to go into the healthcare field. I looked at medicine, I looked at chiropractic, and I thought that chiropractic fit my needs better.
What kind of education requirements and training do you need for this job?
Okay, not all the schools require 4-year, correct, guys?
No, there's a 90 credit prerequisite.
Okay, okay, so it's 90 credits. Some of the chiropractic schools require a 4-year degree. I usually tell people to get a 4-year degree.
Most people have it.
Most people have a 4-year degree. And then chiropractic schools as a 4-year program. So it's about 8 years after high school for most people. I didn't have to do that because that wasn't in place when I went to chiropractic school. I've been out a lot longer, but yeah. So most people it's 8 years, 4 years of undergrad, 4 years of. What'd you say? Quit talking.
She goes, she's old.
I am old. That's okay. Old is good.
What is the starting income for this job or career?
You know what? It is something that is difficult to put a number on because it depends upon whether you start your own business right off the bat or you work for someone. Now it's not uncommon to have, up in the Twin Cities, some of the bigger insurance, some of the bigger clinics have chiropractors Park Nicollet has chiropractors right on staff. So it would be probably similar to what you find a general practitioner. You guys can Google it and see what that is.
You know what I mean?
And how many hours a person work. My docs work about 32 hours a week. We all work about 32. So it's not like a 40-hour-a-week job.
What yearly income range is possible doing this job or career?
Well, the sky's the limit. It depends upon how much you want to work. When I first started, I was the only one working, and I worked long, long hours, and I saw all the patients. So you want to work 60 hours a week, it's going to be a lot. And you're also limited. One of the limits with our profession is what the insurance companies are willing to pay. So, and you have no control over that. So if the insurance company says, we're going to drop your reimbursement, or this is all we're going to pay you, you bill 50, but we're going to pay you 30, you have no control over that. So healthcare, both medicine and chiropractic, any of it, if you're working with insurance companies, we don't know what's going to happen in the future. You have no control over what you're going to get paid. So some of these questions aren't, it's not like an architect where I can say, oh, you're going to go in and the average architect's going to work this number of hours and get this pay range. That's really going to be totally different. Are you a cash practice and you just have a cash price and you get, just paid cash by everybody? Or we're an insurance clinic, so we take all the insurances. Are they buzzing me or you? Okay. And so it really can be as much as you want it to be, as hard as you're willing to work.
Okay.
But there are two different kinds of chiropractic. There's cash, and there is insurance doctors, and we're insurance doctors.
Okay. What personality traits or skills do you need for this job?
Yeah, I can have that. That's fine. Okay, thanks, bye.
You need to be really strong so you can hurt people. I'm just kidding. You know what? I think characteristics for chiropractors in particular, because everything we do is touch. We touch everybody. I do all mine skin to skin, so I use lotion, and I touch a little bit more than just because I do that. I think you need to be really empathetic. You have to really, it's a great profession for women because we tend to be more empathetic. I think you have to be caring, you have to be loving, you have to be empathetic. What other things would you guys say? Characteristics, personality for being a chiropractor?
Good listener.
Yeah. Good
You
listener.
have to be a good listener.
Yeah. One
You
of the
also have to just be physically strong.
Yeah. Yeah, it is a
Physical
physical, it is
Yeah.
a very physical job.
Especially on the
Julie and I
body.
both do animals after, so when we're not here, we do animals. And it's a lot of times less physical to work on the animals than it is on a human. So, at least dogs and cats. Not the kicking horses, but okay.
What are the great things about the job that you do?
You know what? I get to plan my own hours, my own life. You know, I have a lot of flexibility. In this job, especially for chiropractors, I think there's a lot more flexibility than there are in others. We are a team. Our whole, clinic structure, we are a team. And if somebody has to be gone, the rest pick up the pieces. What was the rest of the question?
Just some things you like.
I like the fact that I actually get to have that hands-on contact. My patients think of me as not just a doctor. I mean, they have a different relationship with me. I think that holds true for all of us. I think patients like the relationship because it's more empathetic, when they come in here, they aren't just like, oh God, I'm a doctor. I think they really look forward to coming. And I like that. I like the relationship I have with my patients. And my staff. I have a great staff.
What are some withdrawals, or what are some drawbacks to the job?
The insurance companies. There's a lot of subsidized. There's a lot of subsidized insurance, and we don't get paid very well. We get like $18 a visit for somebody that has some of the subsidized. Well, that's hard. I mean, it's hard on us physically. We don't hold back on things that we do to them. We give them the same treatment, but we don't get compensated for it the same way. So probably the things, what would you say, Julie? The insurance reimbursement is downfalls or bad parts of our
Paperwork that we have to do.
yeah, the paperwork that we have. There's paperwork, dealing with attorneys at times, but probably the biggest drawback is insurance companies don't give us cost of living increases. Any healthcare provider, they don't keep up with the cost of living increases of normal people, and so I would say dealing with the insurance companies. If we didn't have to deal with them and we just knew we'd get X for our visits, that would be much easier for us.
Alright. What's the next step for you? Is there any further you're gonna go, or is this?
I already have twice,
Alright.
3 times. I went back to school to get my acupuncture certification. I went back to school and learned a technique called Graston technique. And a couple years ago, Julie and I both went back to school and got our animal certification. So all 3 of those, we had to go back to school to do.
Okay.
There are advanced degrees for chiropractors in neurology, orthopedics, nutrition, pediatrics. So there are specialties amongst our profession. You tend to do what you like. And so the first thing I did was acupuncture, then learned Graston technique, and then now the animals. So there's other things I could do, but right now I'm okay with doing the things that I do. I stay pretty busy.
Yeah. Do you have anything to add with the career?
I think that this is a great career for women. However, because of the flexibility in that with the schedules, however, I think it's physically more difficult on a female than a male. I think being a chiropractor as opposed to being a medical doctor, I wanted to be able to have a little more control over my life. I didn't necessarily want Big Brother sitting over me. And so we have a lot more flexibility. We were just talking about our hours and who's got what going on, and we're the team. So you work for a big hospital or a big clinic, you're not going to have that. We have that ability. I've had a lot of, actually Dr. Jody was a patient of mine, and I encouraged her to go to chiropractic school. She did. She stayed in Missouri for, 9 years, 10 years after going to school, and then she came back, and now she works for me. So it's a really, really good field for women. It just is. I would encourage women to, and patients, I think if you ask the majority of patients, even men prefer to see a female practitioner over a male practitioner. And that's all across healthcare, dentist, medical. So, I mean, healthcare is a great field for women to get into. This is just a little more flexible, I think. We don't have as many rules, and I mean, I don't have a whip that I hit these girls with.
Most of the time.
Most of the time. No, they're giving me a hard time all the time. It's not about me giving them a hard time. So yeah, that's kind of, you know, here at our clinic, we have all the therapies. We have acupuncture, we have massage therapy. So we really are in a situation that we pretty much can offer everything to anybody an alternative. We have some nutrition stuff. You know, so it's a great profession. Is this something you guys are looking at going into? Is that why you chose this, or so you're both looking at going into it?
I
kind of
more.
am.
You are. So here's what I would suggest that you do. What grade are you in?
11th.
11th. When you get maybe as a senior, if you're still really serious about it, like we have college age, and we've had a few seniors in high school work for us. They have to be mature because you're dealing with people. I mean, and our CAs touch people, you know, they hook therapies up, they pull acupuncture needles. But most of the young people you see that work here, they all are going into some form of healthcare, whether it be nursing, chiropractic. A lot of our students that work here are thinking about going into chiropractic, and we like to hire young people to give you an opportunity to see, is this something I like? Is this something I, you know, you might come and work here and go, oh, this is lame, or this is gross, I don't want to do this. So I would suggest, especially if you're going to stay around here, are you going to stay around here for undergrad?
Yeah.
Like MSU or that? Make sure that I'll walk you back up. I'll introduce you to Dee. Normally, we want you to be at least a senior in high school, but there are classes you guys can take where you can do internships and get credit for it, because we've had some high school kids do that. Isn't there some kind of program? Because I think Julie, haven't we had high school kids that have come in here and gotten
It's like
credit?
a school to work program.
School to work, and we let them work here. And so if you're mature and you really are interested in it, if you're interested in massage or you're interested in acupuncture, we're more than happy to bring students on and let you have some exposure to really what it's all about. It's not us just sitting around eating lunch. And everything is computerized, so I, being the old fart, that's a little harder for me. Julie's a lot younger than I am. She has a lot more computer experience, so that works a lot easier.
Turn the old intro on.
There you go. All right, do you guys have any other questions?
I don't think so.
Great, okay, let me walk up, I'll introduce you.